Now, you start. Okay.
Okay.
Do it. Yeah.
Oh, so just management. Do I need to explain the
Only
diagnosis?
management, because I want you guys to focus management.
Okay.
First of all, check and chunk method. I'm writing check and chunk, patient centered, shared management. Ask me question. Like in last scenario, I have skipped 2, 3 things in back pain, which I would have told, but I was waiting to see you. Please tell me. But I was in quick urge to tell you a lot of things, to vomit a lot of things, but I was waiting for your response. Okay. So I want this from you. Do it.
So, we are suspecting that you might be having a condition called ankylosing spondylitis.
What's that, doctor?
Well, ankylosing spondylitis is a long-term condition where our body cells didn't recognize each other and they start to fight one another. It is the autoimmune condition, and that's why you're feeling stiffness and back pain on your back.
Oh, I see. Okay. So yes. So what will you? Yeah, that's a long time. What will you do for me, doctor?
Well, thank you for asking me this question. So what we're going to do for you right now is we're going to refer you to the bone specialist.
Okay.
Yeah. So bone specialist will do the certain certain tests such as inflammatory markers. Yeah, and as well as the marker for your ankylosing spondylitis, which is called HLA-B27. Yes,
Okay.
and also along with it, we will do some imaging as well. They will do some imaging as well, such as X-ray.
Okay.
For now on, I can see that you're having quite a lot of pain. So we will give you some painkiller, which is called ibuprofen. Along with it, we will give you some medication called omeprazole that will help your stomach.
Okay. I don't want ibuprofen.
Is there any specific reason why?
Because it caused me pain in my tummy. Yeah.
Oh, so you tried it before?
Mm.
Okay, thank you for telling me this. So we will give you another alternative medication such as codeine. Would that be all right?
All right. Thank you.
Okay.
And
Now
doctor,
for
what will
the
happen next? Anything else you want to offer me?
yes, of course. So for the codeine is kind of stronger medication. So I would like to involve my senior to see what medication might be better for you as well. So yes, am I clear so far?
Okay. No problem. Thank you. Thank you very much, doctor. Thank you.
Thank you.
Well, so okay, that's fine. I want to try this one time because I would say that you done very well. Okay, but priority order should be changed for everyone. You done very well. The priority order should be changed for everything. So depending upon the stiffness and everything. So first of all, when you are explaining, guys, I'm telling all of you, when you're explaining ankylosing spondylitis, you will say that it's a long-term condition, like you mentioned. It's going on for 6 months, and you're having too much pain in your spine and the area of the body. Most of the area of body is inflamed. First of all, Khadija is not autoimmune; it's inflammation. So however, this condition don't have any cure because it is genetic, but I'm suspecting it at the moment. But if in the worst case scenario and best case scenario, explain that, and we can decrease this progression. You will explain that, and then you will come to the point that what you will do, confirm the diagnosis every time you suspect the diagnosis and how you will see. So let me try it now for you. So, okay, Michael, as you mentioned that you're having this back pain for so long, from 6 months, it might be quite stressing for you. After having a chat with you, after examining you, I'm suspecting something called ankylosing spondylitis. Have you ever heard of it?
No.
Don't worry, I'm here to help. Let me explain briefly to you because it is a long-term inflammatory conditions of the spine called back. Due to that inflammation changes, you're having this pain and it's more worse in the morning. How it happens, basically, I'm suspecting if it is, it's a genetic condition. It's a long-term condition, lifelong condition, but we need to confirm it. Okay. For that, we have to refer you to the specialist we call rheumatologist. Okay.
Well, who is rheumatologist?
Bone specialists. Okay. They would be in better position to assess you further, but definitely you're in the pain at the moment. I would like to give you some pain relief now so that you feel better. Okay. So, shall I repeat anything for you up to now?
No. Which painkiller would that be, may I ask?
You mentioned that you took paracetamol, and there are a couple of options which I can offer you. One option is a naproxen, which deal with inflammations. So that's a good option, but I'm a bit afraid that can upset your tummy. But I can give you PPI to prevent that. Is that okay with you? All right.
Okay.
Other option I can give you cocodamol. It contains paracetamol plus codeine, but it has some dizziness anyway. So I would, yeah. So both have some reason. I'm sorry for that.
Drive, yeah. So
yeah. Before you go, I will do prescription out of those, whatever you like. Okay.
Okay.
Right. So now coming back to the rheumatologist again, they would do further testing. That would three types of. They will check the inflammatory markers, and they would do a special test for this particular condition, and they would confirm it. If it is the ankylosing spondylitis, they might consider further treatment like steroids and few other treatment options. That's a good thing. The treatment options are here. In worst case scenario, if it is a spondylitis, ankylosing spondylitis, I'm sorry to tell you, it's a lifelong condition. But the good news is that a lot of people, you're not alone. A lot of people have this, and the progression can be controlled, and it can be controlled well with medications, exercise, and you can refer you to the physio as well by yourself. Your GP can refer you. We can refer you once it's confirmed. Okay, you're happy with the plan?
Yes, so, yes, true.
Yeah. Any question up till now? So before you go, I would like to give you a leaflet in which you would know more about ankylosing spondylitis. I'll try to speed up your referral if you have any delay. Okay. I'll be on the same page.
Okay. How many days do I have to wait for the referral?
I think this referral is just a routine referral. It might be, yeah, depending upon. And one more thing I would like to tell you that if you have any concern or any severe pain in the back, any not able to control your bowel or bladder, or feel feverish, you can come back. You can go to the A&E as well.
Okay, thank you.
Any other concern up to now?
No.
All right. Thank you very much. Yes. Good.
Thank you.
So the way that I tried it, we could make it more natural. If the patient says the pain relief, I don't worry about that thing that I'll go there and there. I just talk about, I'm giving options. Pain relief, like I give to my patient option. I can consider naproxen, but I'm worried that but I can give you omeprazole, but you need to top it up every time. And codeine, I'm worried because it contains some dizzy, like some sleepy effects as well. Yeah. So this is how you will proceed your consultation slowly and steadily. So you stay patient centered. You ask options, what you want. So this is this they want. That you ask about the option, what you want and what they want. In this way you go. And you do mention that you don't have cure, but it is a genetic condition. In worst case scenario, if it is, but you're not alone in this. We are here to help. Your mic is turned off if you're speaking.
Oh, no, I'm just repeating.
Okay. Any question from you guys? Saban, Humera, anyone want to ask any question? Any question?
Dr. Zeeshan, sorry, I missed the part. Will we, offer them the support groups?
Yes.
Because it's a lifelong condition.
Support groups, depending leaflets, support groups. You speak, add up your IPS. If you do the data gathering well, you got one extra 1 minute. If I tell you in all of my stations, guys, when I was taking PLAB 2, I never stopped talking because I paid £1,000, number one. Number two, it's highly competitive exam. The last minute I used to speak, even how's everything, how was the day. So the thing is, keep talking. It's a talking exam. If you keep talking, if you're happy to help, trust me, there are loads of stations where I got like 11, 12, 11, 12. But the thing is, only thing I was focusing at that time, I was only focusing on the patient. And I was not thinking that I have to finish it. One or two impactful word, rheumatologist, will you go there? Yes, move to the next. What will happen? You don't need to ask what will happen. You want to know that what will happen. Let me tell you what would happen. You are controlling that ship, but you do take concerns, any other concern you do ask. Okay. So well done. So let's share the scenario again. Okay, so we'll finish the rheumatology scenarios, and after that, we'll cover the. So we was here on the yes. Now your time. You have to do this scenario. Yeah. I'll show this scenario. So you read it, then I'll put on the timer. Guys, the whole idea of getting these simulations done, delivery done, because this is an exam of talking. If you are just reading slides, I'm not telling you the thing and how to do it. So this is the whole, as a UKPass Academy, we are doing it. We want to show you how it can be delivered. And if you're getting 6, 7, still you're passing, you don't need 12 out of 12 in every station. So now Dr. May would be doing that. So I'll go through this station, then you will just do it. We need to deliver. 54-year-old has been presented with the pain in the right big toe, have been pain in my right big toe. It is big toe. It's progressively becoming worse. Walking make it worse. The pain started 1 week ago. The toe is swollen, red, but not fever, but no fever. You live alone, works as a taxi driver, no allergies. You smoke 20 cigarettes a day for the past 15 years. You drink 4 pints of beer every day, at least 3 to 4 times a day. You work as a taxi driver. So 69 female made an appointment to see you at the GP, went to Well Women Clinic. When the nurse saw your joint swelling, she asked you to see your doctor. She has come in the swelling of the joint in both hands. She has no pain in her joint. The joint swelling has been here for a long period of time, about 5 years. There is no pain, no stiffness, no fever. You have had hypertension long period of time. Initially, your blood, you were placed on bendroflumetazide, but you developed gout, so they placed you on colchicine. They placed her on amlodipine for high blood pressure. She had gastric ulcer in the past, so cannot take ibuprofen. She reacted to colchicine with rashes, so it was stopped. Referred to rheumatology because she cannot tolerate colchicine. So yes, so you already know that I'm going to give you a scenario of. I'm going to give you a scenario of swelling. Okay, so swelling could be anywhere. So don't expect only gout. It could be anything. Okay, so making it could be anything. Go smooth with your history and just think about the DDs of the gout and everything. So let's make it a little bit more like examining. Maybe it would be a gout, it may not be. So just 1 second. Okay, so I'm going to put on the timer. So I am 55-year-old male. So what I am doing, I came with the pain on my knee. Pain on my knee. Yes, pain on my knee.
Okay.
And speak to the patient, address the concern.
Okay, am I in GP or A&E?
You are in the GP.
GP. Okay, thank you. All right.
Let me put on the timer. Can you keep your timer? Just give me 1 second. Do you have a timer?
I don't have a timer.
Okay, just give me 1 second. Let me keep the timer.
Maybe other people who joining the session can do it as well.
I'm keeping it. Yes, starting now.
Okay. Hello.
Hello.
Hello. Hello, I'm Dr. May, one of the FY2 doctors in this GP clinic. Could you please confirm your full name and age?
My name is Michael Brown, and I'm 58-year-old.
Okay. Well, Michael, what brings you here today?
Doctor, I'm not feeling well. I'm having redness and pain on my knee joint. It's hurting a lot.
It's hurting a lot. Are you comfortable enough to talk with me right now?
Yes, I'm comfortable to talk to you, but it's very painful, doctor.
Of course. To give you the appropriate painkiller, okay, I would like to ask you some little bit question.
Okay.
Okay. So could you please tell me more about your pain? Which knee you having the pain?
It's a right knee, and it's very very tender, and like it's very tender.
Okay. What about on the other side?
Other side is okay.
Are you able to use your knees, like maybe walking? Are you able to do it?
Yes, I'm able to walk, but it's very painful.
May I ask you how you come here?
Sorry?
How you come here?
I came with my partner.
Oh, that's really great that your partner is helping you.
Yeah, thank you. But I can walk. There's not a problem with walking. I can walk.
Yeah. So
It's painful.
I can see you're quite having a lot of pain. I will try my best to help you, okay?
Okay.
Could you please tell me when did it started?
Sorry?
When did it started?
It started like, if I tell you, like 3 months ago, 6 months ago, I got the similar pain. And after then, doctor gave me some medicine, and I went home, and that was okay. They gave me medicine for 3 days. And that got okay. I went to A&E at that time. They mentioned me to go to the GP to get some prophylactic medicine for that. I don't know, but I couldn't manage to go there.
Did they tell you what happened in the last 6 months?
Yeah. They mentioned that might be I'm having something related to my uric acid level or something.
Oh, okay. So it's on the same joint.
Sorry?
Is it on the same joint or is it anywhere else?
It's not on the same. It's another one.
Okay.
First
So
first I got in my ankle area, and now
okay.
it's on my knee.
Oh, okay. Thank you for telling me this about that. So, so it all started happen suddenly, the pain on your knee.
It's like
Okay. So is it comes and go? It's continuous pain.
it's at the moment it's a continuous pain.
Continuous. Okay. Could you please describe the corridor for me?
Sorry?
Could you please describe the corridor for me? The pain.
Yes, like sometimes very dull or sometimes very aching pain. It
Mhm.
aches like radiation, just aches like.
Okay. Does it go to anywhere else or only on?
No, just is on my that particular area.
Okay. So what is, do you try anything for your pain?
Yeah, I tried paracetamol, but unfortunately I can't have ibuprofen. I'm asthmatic.
Okay. So this is getting worse, right?
Yeah,
From scale 1 to 10, 1 being less pain, 10 being really painful, how would you rate it?
I would say 7.
7. Wow, that's quite a lot of pain. So well, I will try my best to help you, okay?
Okay.
So you say there's a redness and there's a swelling as well, okay? And there's a pain too. Along with it, do you have any fever?
No fever.
No fever at all. Okay. How's your bowel movements?
Okay.
Bowel movements are okay too. Okay. So do you have any diarrhea or anything like that? Okay. Do you have I would like to ask you about your food diet as well. Okay. You recently had any kind of food poison or anything like that? Maybe vomiting? No
No,
tummy pain?
no,
Okay, nothing at all. Okay. Do you travel anywhere recently?
no,
Okay. So so do you have any underlying medical conditions?
no, doctor.
Nothing at all. Okay. Are you taking any medications?
No, doctor, I'm not taking any medicine.
Okay. So well recently do you injured yourself?
No.
Okay. So may I ask you that, so you have no allergy as well, right? Okay. So how's your partner doing as well? Is a partner is all right as well? Your partner.
Yes, okay, it's okay.
Okay. So I would like to ask a little bit more about your sexual health too. Would that be okay?
Okay.
Okay. So so do you use condom or safe sex like that?
Yeah, everything okay.
Okay, that's good. So what about your urinating? Is everything okay? Do you feel any burning sensations?
Yes, everything okay.
Everything okay, that's great. So what about your diet? Could you please walk me through about it?
Yeah, I like meat a lot.
Meat, okay.
I like every type of meat. Yeah.
Okay, do you smoke?
No?
Do you drink alcohol?
Yeah, I drink a lot of alcohol as well.
Okay, so could you please tell me more about how many?
10 to 20 pints a day.
Okay, have you tried thinking of stopping it or anything like that?
Yeah, I'm thinking so. So no, might be.
Okay, do you have any thoughts about my video calls?
Maybe same. 2 minutes left.
Okay, so do you have any concerns so far?
I just want to get it fixed because last time doctor told me that ibuprofen I can't have or something like call I don't know whatever. I couldn't have that, so that was very tough time for me. And
Okay,
it served as well.
it's all right, no worries. I will try my best to help you, okay? So, well, thank you for telling me the really valuable information. I would like to examine your right knee. Okay, I would like to take your vital signs such as blood pressure, temperature as well. Would that be all right with you?
That's all.
Okay.
Yeah.
Okay, so it's gout. Okay, so well, so thank you for telling me the valuable information. So well, from the conversation we had, you tell me that on the anger you had it before too in the last 6 months as well, and also from the conversation we had and from the examination I've done, I'm suspecting that you might be having a condition called gout. Have you ever heard about it before?
No, what is that?
It's okay, I will tell you about that.
Yeah, okay, the same one which I got the previous one, the gout. Yeah, the doctor told me uric acid level or something. Yeah.
Exactly. So
Yeah,
your
yeah.
uric acid level is high in your body, and that deposit on your joint area, and that's why you
What
feel.
would you treat me, doctor? Because I can't have any ibuprofen or what other medication. How would you do treatment for me now?
Well, thank you for telling me it. But currently, right now, you say that I can see that you're having the redness and swelling. So I would like to involve my senior and do joint aspiration as well.
Okay.
To exclude any kind of infection too.
No.
Yes.
Thank you. Thank you, sir. To the next station. Oh, well done. So the gout can gout can come on knee or not?
It can, but I was
It's
thinking
very
if
rare, isn't it?
it's yeah. Sorry, I was thinking if it is reactive arthritis or anything like that. So
I do understand you were thinking that way. You've done a lot of DDs, so let's do it. But I told you that I got same thing before and same thing here. So yes, gout can transfer from toe to the knees, and you have to take the history very well and examination itself. But I think you got a bit stuck with the history, with the knee pain and everything. But that was okay. So let's quickly debrief this scenario, then we'll move further. So in this scenario, uh, basically you have to uh, go through the Socrates. You done the Socrates. You took the history about the fever. You do ask about fever. You asked about nodules and everything. And coming to the macros, I did ask about alcohol and diet. I told you that I like meat and everything. That was done well. And but when management part, so you was not able to explain well. So there was some non-medical and conservative treatment as well, what you can offer. And that is rest and raise limb as well. In the gout, you can tell that as well. And you have to refer to the rheumatologist because you can't have any of the naproxen, colchicine, because he was not able to take that. I told you, can't. So you have to refer to the rheumatologist here, and you have to refer to the dietitian as well because he is eating too much diet, like meat, everything. You can explain about ice packing because it's definitely inflammation, but you can explain about ice packs, and you can explain that I'm sorry that I'm afraid you're not able to take the colchicine, but you might need steroids. Steroid is the second line for the gout. So if somebody is not able to take colchicine, the second line is steroid, could be IM per oral. So the better way is to refer to the rheumatologist or maybe speak to senior to consider steroid. Okay, so preventive medication, you could have tell that you might have to go to the GP at that point. They might have started you allopurinol. Yes, so this is what you have to do, and you ruled out everything. But management part, you didn't score well, and in the middle of that, when you were struggling, you lost a little bit IPS as well. But overall, your consultation was good. But again, you have to do something in management, and you can tell conservative part, ice packing, second-line steroids, referring to the rheumatologist or speaking to senior to consider steroid in second line. Okay, that was a quite tricky anyway. So, well done. Any question, guys? We'll take a 10-minute break. At 4 o'clock, I'll come back. We'll take a 10-minute break. At 4 o'clock, I'll come back. Okay? 10-minute break, guys. Yes, welcome back, guys. So I'll be showing you a few more scenarios from rheumatology. Then we'll be finishing with the rheumatology. I'll quickly share my screen now. Okay, so welcome, guys. So I quickly go through the rest of the scenario. So gout has been done. So few similar scenarios which you can see in the rheumatology is polymyalgia rheumatica is one of the scenario which you can see that. And before that, I'll show you that what Dr. May was thinking about reactive arthritis. What the scenario would be for the reactive arthritis would be. The scenario could be like this. 25-year-old male presented with ankle and knee pains. Okay, you were in South Spain for vacation and developed diarrhea and vomiting 3 weeks ago. And on his trip, on returning, you develop aches in your knees and ankles. So that is a different, that is aches. So no restriction in movement, but feel joint stiffness every time he rests and try to move, which loss depending on how long he has rested. So no issue bearing weight. So the same one, no history of trauma, mild swelling and redness. Yes, it's quite similar to that. No bleeding of vein, no smoker, no recreational drugs, effective life only when needs to move around at work. Office worker and needs examination fine, ankle pain, or checking the tone. So this is what you would do. That would be a similar scenario. But the scenario which I have given to you was another episode of what we call gout. So basically, I was giving you this scenario, but the area is on the knee area. So it can be knee area as well. So just keep in mind that both can be in the knee area. So follow your instincts and go according to that. So now I would tell you a few of the information about polymyalgia rheumatica. So what two types of scenarios you can do in polymyalgia rheumatica. And after that, we will do the simulation for the polymyalgia rheumatica, and let's see how we able to do the polymyalgia rheumatica. So we're supposed to do the first presentation for that for the polymyalgia rheumatica. So let's tell you there are two presentations for the polymyalgia. So we have done GCA today. So it is more or less related to the GCA because the management would be the same. Like you will be starting him or her on the steroids. So let me show you scenario first. 67 year old female has presented with body ache pain in the GP setting. The patient would say, I have a pain on my shoulders and my hip joint. Pain for more than 1 month, have dull pain in shoulders and hips. So that could be the positive finding. The pain in the shoulder and hips getting worse. Paracetamol used to help, but not anymore. He's able to do activities with difficulties. He has been diagnosed with heartburn, and you are taking omeprazole. So has difficult in raising her hand above. So you will ask, have difficult raising his hands above, and shoulder and pain in thighs and hip when standing up. The pain and stiffness improved by the end of the day. So again, so you've got a couple of scenarios when the pain and stiffness. So first of all, when somebody is going to say that I have pain, you will check that pain is this pain is on the muscles or is the pain is on the joint. So in this scenario, polymyalgia rheumatica, the pain would be on the big muscles of the soreness of muscle. The pain stiffness improved by the end of the day, have morning stiffness. You are normally fit and well and not on any medication. Patient also have been feeling very tired. So one scenario would be this. And the other scenario for the polymyalgia rheumatica could be like this. 60-year-old women have come for follow-up. Patient had presented to the GP surgery 3 weeks ago with the pain in shoulders and hip. Blood test 1 week ago, ESR is 55, CRP is 45. A diagnosis of polymyalgia rheumatica was made and patient was placed on steroid and lansoprazole. So one is first presentation and second is follow-up presentation. I want someone from, so May, you want to do it as a patient or doctor? Tell me. So anyway. So
I can do both.
Sorry?
I can be both. It's okay. The Dean, doctor, being patient.
Okay, so let me quickly tell you a few points. So all of you who are seeing us,